All right, good evening, everyone, and welcome to ATP Live Monday. All right, I hope you can see me, you can hear me. Oh, sorry, I think I'm not live yet on Instagram. All right, okay. All right, good evening. Welcome to ATP Live Monday. I am Gbemisola Boyede, your host for this evening, and I want to welcome you for joining me today. ATP Live Monday is a program where you get to ask any question that you may have about the health of your children, and we will try and answer them in 1 hour. So, welcome everyone. I hope how has your day been? Um, So the first thing I'm going to do is just to share the video to all the pages and the groups. So just give me a couple of minutes to do that. Then we will start to go to the program proper. Uh, because if I say some things now, I will have to repeat it again. So let me just use the first few minutes to share the video to our Facebook groups. You can also share it to your friends, to them, whether on Facebook, on WhatsApp, on whichever platform that you have, you can share to people so that those who have questions about the health of their children, they can also join us and get to ask their questions. So, welcome everyone, whether you're joining me on Instagram, on Facebook, on YouTube, you're welcome to ATP Live Monday. And if you are watching the recording, like if you're not watching live, I also want to say welcome. So if you're watching 6 p.m. West African time, you're actually watching live on a Monday. But any other time after 7 p.m. on a Monday, you are watching the video that has been recorded. So, but I also want to welcome you because I know a lot of people do watch the video much later on. So, welcome to ATP Live Monday. This is our second episode for the year. Um, ATP Live Monday is a program where you can ask any questions that you have about the health of your children, and I will try and answer them in the next 1 hour. It is brought to you by ATP Pediatrician's Foundation, and for those of you who are familiar with ATP, we are committed to the health and the welfare of your children. And this is our 10th year doing this, and it's been a privilege to be a partner along with parents in raising healthy children. So thank you so much for joining us. But just for you to know that if you have questions beyond this live session, you can always go to our Facebook group, Ask the Pediatricians Facebook group, and you can ask your questions there as well from Mondays to Saturday. So that is not just an hour. You're welcome to ask your questions anytime. And between Mondays and Saturdays, any time of the day, and one of us, one of our team will be there to answer your questions, And one thing that is different, I know there are lots of platforms where people do ask questions on social media, but what makes Ask the Pediatrician unique is that whatever answer you get from us, you can be sure it's evidence-based, it's from the professional perspective, it's from a specialist perspective, so you can take it to the bank. Yeah, that's what is unique. So it is not a democracy of opinion, a guess game where people are actually more confused at the beginning, at the end than at the beginning. But what you get from us is something from the perspective of pediatricians who, we're the specialists that are involved in care of children. So whatever you get from us, you can always take it to the bank. So I think I've shared the video. I think good to start. All right. So Let me now welcome everybody once again. Oh no, there's so many questions already on Instagram. All right, good evening, everybody. Welcome to ATP Live Monday. Today is the 13th of January 2025. I am Gbemisola Boyede. I'm a pediatrician, and it's my pleasure to welcome you to ATP Live Monday. I'm going to be here with you for the next 60 minutes or less and just answering any questions that you may have about the health of your children. But if after the live session you still have any questions, feel free to go to Ask the Pediatrician Facebook group for children health issues or ATP Family for any other questions that is not for children, actually adult health issues. We also have our first time mothers group, and we also have our ATP Still a Mom group for providing emotional support to those who may have been, bereaved, of children or pregnancies. So thank you so much for joining me today. And I'm going to start because my Instagram questions tend to run off if I don't take them quickly. So the first question, good evening, Major Evers. Thank you for consistently joining me on Instagram every Monday. It's a pleasure to have you here. Yoyemi, good evening. Happy New Year once again. Thank you. Yemi said my question. My 19-month-old daughter has her left knee inverted. I'm trying to understand your grammar because we don't tend to use the word inverted or everted when it comes to the knees. We use that for the feet, but I guess something is unusual about the knee of your baby. Okay, knock knees. Okay, fine. That sounds more, I can imagine knock knees, bow legs, all those kind of things. There are things that can happen in children. It depends. Some of them are just what we call familiar. He tends to run in certain family. There's nothing wrong. As the children gets older, it's kind of straightened out, and that is it. But some may also be signs of a child who has some maybe vitamin D deficiency, rickets, calcium deficiency, and all that. Most of the time, it's difficult to know unless we see it first. So I would recommend either you take a picture of this leg and post it on our Facebook group so that one of our professionals can have a look for you and say whether, okay, this is something we just watch and see whether it will correct by itself or whether it's something really quite significant and we're worried about rickets or any of the other abnormalities that can cause such issues with the legs. So in which case we want to see you in the hospital. We want to see either a pediatrician who can do the blood test or whether you want to see orthopedic surgeon. So a picture will be helpful in this scenario so then we can be able to advise. We can't just advise you to watch and wait or whatever without seeing it. So it's difficult to tell you what to do without having a look first. So Ayoyemi, I'll recommend either you take your child to see a doctor who can have a look and tell you whether it's nothing to worry about, or you can just put a picture on our group and then we can have a look for you. And I hope that may be helpful for you. All right, thank you so much. I think that's the only question on Instagram for now. Okay. All right. Okay, let's move on. Welcome. Good evening, Annabelle. Welcome. What are you congratulating me for? I can't this is something. All right. Anyway, thank you. Is it about our 10th anniversary? Yeah, maybe that's it. I think we need to put it somewhere. Okay. Thank you so much. So for those who are just joining us, welcome to ATP Live Monday. If you have any questions, please ask your questions now. Ask your questions, and I'll be here. But like I said, if you come in later, we're no longer live, or you have questions later on, you can always post your questions to our Facebook group and then we will try and answer them for you in 24 hours. You can always post your questions, and we also have groups for adults as well, where you can post your questions, and you can do that from Monday to Saturday, so no pressure, and we'll always answer them anytime. I mean, as soon as we can. We always give us at least 40 to 72 hours. But of course, if you have an emergency, please don't post. Somebody posted a picture of a child who suffered hot tea burns, like hot tea poured on the child, and of course, the child had what we call like scald injury. Now that's an example of don't post on Facebook. That's an example of you take your child and you go to the hospital, because what are we going to do? Of course, there are some basic first aid which we normally teach parents on what to do, first aid care and all that, so which you should know. But at that point, it's either you are doing that first aid or taking a child to the hospital. It's not a I want to post on the Facebook kind of scenario. So I always like to let people know when not to ask the pediatricians online, rather when you actually have to go and see the pediatrician face to face versus when you can ask. But if you want to just ask general questions, okay, should I do this? What should I do? Things that are not emergencies, of course, you are welcome to always post your questions, and then we can always address them. Also, to know that we do a teaching every Thursday at 6 p.m. as well. So if you have any, we take specific topics. And I think last week one of our ophthalmologists took a topic on refractive errors. So all these children wearing glasses, why are we giving children glasses, whether they're short-sighted, long-sighted. So Dr. Gbemisola Boyede took a teaching on refractive errors, what parents need to know, when you need to go to the hospital and stuff like that. So if you have not listened to that, I think I'll recommend that you listen to it, because it's always available on our page, whichever page, just check for our last teaching. So, and of course, if you want to read more about any of those topics, you can also check our website. We always have information on our website that you can read on virtually almost all the topics that has to do with the health of our children. You can always read also on our website. You can also watch our YouTube channel for all the past videos. They're always on our YouTube channel, so you can always watch the one that is suitable for you. All right. Okay, Annabelle Ado is asking, good evening. When can I start sitting my baby? He is 4 months old. Okay, that's a very common question. We do get a lot from mothers. And I always like to say by the simple answer is that you don't need to teach your babies how to do anything. You don't need to teach them how to sit. You don't need to teach them how to walk. You don't need to teach them anything at all when it comes to developmental milestones. Developmental milestones happen as a result of the maturation of the brain. The brain is one of those organs, well, maybe the only organ, to be fair, that is not fully developed at birth. So when the baby is born, only 75% of the brain has been formed. So as the baby is getting bigger, the brain is actually getting bigger as well, because the baby side is increasing, because more brain tissue have been formed and more link between the brain cells are being formed. And that is why we have all those spaces in the head. Mothers tend to worry about those spaces because they're anterior fontanelle, posterior fontanelle, and we have the sutures. All those spaces are there in the head, in the brain box, in the skull, to allow for the anticipated expansion of that brain, because we know the brain is going to get bigger and it's going to increase in size. So the head, the covering, the skull, the brain box must be able to expand to accommodate that increase. So is that increase, is that development of the brain that leads to children developing milestones. So that's when they start to control their head and they start to sit and they start to scroll. In some instances, not everybody crawl and walk and talk and become more or less independent adults. So it is something that happens on its own. You don't force it, you don't teach it. So it's the brain that tends to do it by itself. So you will know when your child is reaching the next milestone, because you start seeing the child automatically start lifting their head up and they start trying to assume that position by themselves. So they will do it on their own. You don't have to start sitting. So I see a lot of mothers trying to sit up their 3-month-old baby, putting them in boxes and stuff like that. That is actually wrong. You don't need to do all that, you should just leave your baby and wait. But if you want to know like at what age averagely most babies will sit, averagely by between 5 to 6 months, that is when babies will sit. And so when they start to sit, what we call sitting with support. So initially when they start to sit, you have to put something behind them, or you have to sit behind them, and they should not be sitting for more than 5 minutes. And then by the time they're about 7 to 8 months, they're able to sit by themselves without any pillow or anything behind them, and their back will be straight. So you don't need to teach a child to sit. The child will sit by themselves, and you don't need to start forcing them into that sitting position until they are ready. Because even though we say this is the average, all children do things at different times. So you just have to wait until that child. Some will do a little bit early, some will do a little bit later, but they say normal range. The only time we will start to get to worry is if the child has not yet achieved a milestone, as at the time we expect another milestone. For example, we expect children to sit by 7 to 8 months independently, and then maybe crawl around 9 to 10 months. So by the time the child is 9 to 10 months, if the child is not yet even sitting independently, so the child has failed to achieve the milestone even before the one for the child's current age, then will be when the pediatrician will be worried that this is a little bit slow, and then we want to know why, and then we want to investigate it further. So that is about developmental milestone. So if you want to read more about developmental milestone, we have a lovely article on our website. It's My Child's Development on Course. I would recommend for you to read that, Annabelle. It tells you when we want you to come and worry. I mean, when we don't always want you to worry, but when you should come and talk to us, if you're, this is a range. This is when the pediatrician will worry, and that's when we want you to come. Otherwise, you will just want to come every single thing for everything, which may not necessarily be worth it. So we want you to wait until the child has not yet achieved certain milestone at certain age, and then that is when you come and see a pediatrician. Okay, I assume you're a first-time mom, Annabelle, because your questions are the kind of question we get in first-time mother, which is okay. But I think you are the kind of person that will benefit from having our first-time mother's products. You will really love it. You say, what can I use for teething? What drugs can I give for teething? The simple answer is you don't need to give any drugs for teething. Just like I explained about the developmental milestone, teething is also another development that happens in children on its own. You don't need to give them, and it's not a disease. It's not a disease. It's not an illness. So it is a normal thing for children to bring out their teeth. So children bring out their teeth normally. You don't also have to force it to happen, and it doesn't hurt them, and it doesn't make them sick. So they don't need any drugs for teething. I know, for mothers it can be quite tricky, because you hear people say, oh, that's a teething powder, that's a teething mixture. I'm just telling you as a pediatrician that we pediatricians did not recommend any of those things. These are things that people come up with and decide that they want to sell. And of course, sometimes, apologies, sometimes mothers just, obviously want the best for their children. And so anytime they hear this, they just jump on it. No, it's not everything they sell in those baby stores that you actually need to buy. And one of the things that's even more dangerous is when you now start coming to drugs. And we don't recommend any so-called teething mixture, teething powder. You should never give them to your children. Never, ever give them to your children. If you think your child is sick, don't assume teething. A lot of mothers think, oh, when a child is having fever, or a child is coughing, or a child has diarrhea, or it's because of teeth. Everything is teething. No. A child can be sick and it has nothing to do with the teeth. Even though the child is bringing out teeth, it doesn't mean it's a cause and effect scenario. So don't give teething powder, don't give teething mixture. Children will bring out their teeth and doesn't cause any harm. If the child is having fever, if the child is having any symptoms, please do not say it is teething. Do not accept that diagnosis from so-called experienced mothers. Just take that child to the hospital. If the child has fever, you can give paracetamol, take to the hospital, and let us figure it out. That's our job as pediatricians, to figure out why the child is having those symptoms. Don't make teething assumptions. I can't tell you how many times as a pediatrician I have worked in a government hospital, and we have very sick children, And then the next question you ask the mother is like, how long has the child been sick? And they're like, maybe 1 week or whatever. I mean, like, wow, what have you been waiting for? What have you been doing? Why didn't you come to us on time? And the typical response you get is, oh, they say it is teething, and I've been giving teething mixture, and that's why I've not come. And I always tell mothers that we pediatricians, we only care. It is God that heals. We are only co-workers with God, but we have our limitations. So the earlier you bring children to us when they are sick, the better. If it comes to us too late, sometimes we can't do anything about it. Honestly, that's the truth. So we don't want people delaying coming to the hospital because they think the child is sitting, and that is why. And that is the commonest diagnosis mothers make. The experienced mothers, child is having a little thing. Oh, it's because of the teeth. The child is coughing, his teeth. The child is having rashes, his teeth. The child is having diarrhea. I mean, how can the teething cause all these symptoms? So please don't take it from them because you're a first-time mom. If your child is sick, come and see the doctors. Don't take any teething diagnosis from any experienced mothers. Annabelle, I hope. So summary, no teething powder, no teething mixture, no teething anything. All right, I got another question on Instagram for Dizenyok. Okay, good evening, Doc. My baby was born October 9. I may be confused counting. Okay, so I'm sick. I'm beginning to get a lot of question about date of birth, date of with my baby 3 months. No, you should just, this is maths, this is not pediatrics, okay? It's the same way you calculate date for anything. That is the same way you calculate the age of your baby. Forget whatever. Don't get yourself confused. There's no confusion. The same way you normally calculate how many months ago is this, that's the same way you calculate it for date of birth of your babies. There's no special anything there. It's not pediatrics, that is mathematics. So your date of birth, your baby is born October 9. So calculate 6 months, October 9, November, December, January, February, March, April. April 9th, your baby is 6 months. End of story. There's no confusion about date of birth because all the months are not equal days. Some months are 31, some months are 30, some months are 28. It doesn't really matter to us. Just calculate the months the same way you do it for everything. So the same way you know your baby is going to be 1 year on October 9th of 2025. It's the same thing. So there's no, I don't know where people start getting confused about, because you are trying to calculate in weeks, and then because you are calculating in weeks, and just leave that out. Calculate it the way you normally calculate every other date for any other thing else. There's no special anything. So that is it. So just there's no reason to be confused at all. Yeah, we do calculate what we call a corrected age for babies that are born preterm. But I always leave that also to us to do. Let the pediatrician be the one calculating the corrected age. It is to us that is relevant. For you, just go with your baby's age in chronological age and calculate it the same way you normally calculate how many months. Just count it forward. Don't be counting, is it 4 weeks? Is this 3? Oh, this one is, no. Don't do that. Don't do 7 days and 4 weeks and all that. No, just calculate it month by month like that, and you will not have any reason to worry. So I hope that is clear for this new. I don't know whether you are the one that asked that same question on our Facebook group, but it's the same answer. So it's not complex, and we don't overthink the calculation at all. So April 9, your baby will be 6 months, then you can start complementary feeding. No stories. Okay. Tricia, good evening. Why is my 4-year-old toddler stuttering all of a sudden? I can't say why because there are many possible reasons why your baby can stutter. And so for some children, it's even nothing, just a passing phase. You just go through that phase where they just stutter and they will just also outgrow it. So the most important thing is to be patient with the child. Unfortunately, when people stutter, parents and adults around them will tend to be impatient, and actually that will actually make them stutter the more. That will actually worsen it. So what you need to do is just give the child time. You want to improve their confidence, so you want to let them Take their time, don't rush, say whatever they want to say. Just give them time. And it's something that most children go through as a phase, and it tends to stop. But if, of course, if it's going too long or you're worried about it, you can always see the speech therapist, and the speech therapist will do their own assessment and work it out for you. But most of the time it's a passing phase. Sometimes they actually copy other children, sometimes it's just something, but just don't pay attention to it. Don't draw attention to it and tell them, oh, slow down. Just leave it. Let them just say it. Just be patient with them, and let them just, and give them that time to know that they are not in a hurry. You're also not in a hurry. And then when they are ready, you just they just kind of fade out. So there's nothing to worry about. All right. Okay, this is not, it was you. Yes, okay. So don't overthink that question. It's a very, just calculate it. If somebody tell you, I'll come and meet you in 3 months' time, the same way you calculate your period, my period in 3 months' time, it's the same thing. There's nothing special about calculating dates, so that's it. All right, charming for king. What could be the cause of the recent high rates of autism in children? What could be the cause? Okay. I will answer the question the way I normally answer parents, not the way I will answer my professional colleagues. But for parents, number one, I think we actually more aware about autism. So a lot of people who have autism before, but because people don't know what is autism, they don't even know how to get it assessed and all that, they were not diagnosed. People just lump it together as either learning disability, intellectual disability, or just special needs. But now I think most people are quite aware of autism. Most parents are quite aware of autism. And so people are beginning to recognize it on time. People like me also talking about it all the time on social media. People like you coming to ATP and asking, oh, my child is not talking, he's doing this, he's doing that. And I say, oh, go and do child screening. So there's a lot more awareness. People know more about autism. People are asking about autism. So we are picking up the children early. So it's not because it's actually increased per se, but because we are actually picking it up, due to increased knowledge. That is number one. Number two, we actually think there's actually an increase, true increase in the number of children that are having autism. Why that is, we don't know yet. There's a lot of research going on. We think there's some issues of genetics. We also think there's some issue of nurture, environmental factors as well. So nature, nurture, autism. And also, I think also the fact that more people are now quite conversant with autism and they're able to pick it up early. We're able to screen our children early. So it's a mix of the two. It's a collabo. So that's why we are having a lot of autism. Okay. In children, especially in males, in males having higher rates of autism has always been like that. It has nothing to do with that one is not new. Boys have always have autism more than girls. We've always known that forever. Okay. And then your question, is it true that too much of paracetamol during pregnancy causes autism? Not true. That is not true. Okay. Autism is not caused by paracetamol. It's not caused by vaccines. That's why I'm telling you. To be honest, the short answer is that we don't really know the cause of autism. We know there are some genetic factors because I've had families where all the children have autism. So we have families that everybody have autism. So there must be something in the genes. And of course, there are some genetic conditions that when people have those genetic conditions like fragile eggs, like Rett syndrome gene, when people have those genetic conditions, they have a higher rate of having autism. So there must be something about the genes. The fact that it's also run in certain families, the fact that it's boys more than girls, there must be something in the genes that is making people to have autism, but we don't know the particular gene. There are different genes, maybe about 200 of them have been identified. So we know there's something genetic, but we don't always have the genetic abnormality, if that makes sense. So but it's not paracetamol. Of course, it's not good for you to be taking drugs anyhow in pregnancy, but it is not the cause of autism. So let's not puts that there. So I hope that's helpful. April is always the Autism Awareness Month. That is when I do my teaching. I do a teaching on autism every April 2nd. That is Autism Awareness Day. And I also always get people to ask me a lot of questions about autism. But you can also go to our website, read more about autism. Autism is more, parents, everybody's aware, everybody knows autism now. But we still, honestly, we don't know the cause of autism, but we have we have some ideas, but we don't have like this is one thing that is causing autism. We think it's a mix of things, involved. So I hope, Chomi, that has helped. All right. And if you suspect a child has autism, please make sure you come to us on time. So I hope that's helpful. All right. Okay. I'm sick here. Someone, Sarah say, how come, are you shy? No, I don't think so. I think because my my laptop there's a way my laptop is positioned. So when I'm talking, sometimes I'm looking up. So I think I have to keep looking down to get to my laptop level. But I always try to remember to look into my laptop camera. I don't know whether that's what you are referring to, but I will try and keep my face down. All right. Jamie for King, can autism be detected in a child that is still in the womb? No, we can't diagnose autism in a child. Autism is not like malaria. It is not like it is not like I'm looking for conditions that you can diagnose early, like somebody who have even sickle cell anemia, those kind of things. No, autism is not like that. The way we don't diagnose autism by blood tests, we don't diagnose it by doing any X-ray or MRI, all those kind of things. So because of that, there's nothing you're going to test for when the baby is in the womb. If it's a genetic condition that runs in a certain family, you can test for that gene in the family, but it is not the it's not going, it can tell you the child has this genetic condition, the child has Fragile X syndrome, whatever, but it's not going to tell you that child has autism. Autism is a clinical diagnosis. In other words, we have to see the child. The child has to demonstrate certain behavior. So autism is diagnosed by seeing certain behavior in that child. The child must have difficulties with what we call social interaction, difficulties with what we call making friends or interacting with people, or social reciprocity, the give and take of things, and also some behavior, repetitive and restricted kind of behavior. So there are certain behavior that you get in children, and so a child must tick certain number of boxes in the what we call the diagnostic criteria for you to give a diagnosis of autism. So autism is not like we'll go and do a blood test. Like if a child has malaria in the womb, we can pick it up because we can do a blood test in the placenta and the amniotic fluid, whatever. But that is not autism. Autism, you're not doing any blood test, you're not doing any X-ray, you're not doing any scan, you're not doing EEG. You diagnose it by looking at the behavior of the child, seeing that it's present in the child, and also present in maybe in school, like 2 or more settings. So there, and the child must tick certain number of boxes for you to give a diagnosis. So it's a clinical diagnosis. And while I'm still on that topic, let me just say that it's not everybody it's not all the doctors that can actually diagnose autism. It's not all the doctors that can do the autism assessment. Even when it comes to pediatrics, not everybody that can do autism assessments, and so you have to make sure you're seeing the right specialist when you are if you suspect a child has autism, so that because a lot of parents sometimes go to the wrong doctors and they tell them, oh, there's nothing wrong with the child, or they tell them, don't worry, the child is going to outgrow it and all that, which is actually not true, not helpful. So make sure you see, usually the best people to see will be the developmental pediatricians or clinical psychologists that are trained in autism assessment and diagnosis, or the psychiatrist, child and adolescent mental health psychiatrists. So those are the people that can support or help with the diagnosis of autism, but it's not a antenatally diagnosed condition. We don't diagnose autism in the womb. I hope that is helpful. Uh, Some for King, you seem to have a lot of concern about autism today. But anyway, in April, we can do a lot more discussion around autism during the Autism Awareness Month. All right. Okay, so if you have question, feel free to ask your question, and we will still be here. But while we're waiting for more questions, just to say that having autism is not the end of the world, and there are lots of professionals, there are lots of um, people that are doing so well that are on the autism spectrum, and these days people don't see it as a condition or a disorder, they see it as a difference. In other words, the way people who are on the spectrum relates to the world or relates to people is a bit different. So they tend to call themselves we call it neurodivergent, so something just different, not like is wrong or abnormal. So that's another way of looking at it. So of course, people that autism is a huge spectrum. So you have on the spectrum people who are very intelligent, able to do everything, even super intelligent. And also you have people who have, the severe autism associated with intellectual disability, who cannot talk, who have a lot of, repetitive behavior, so who have more severe needs. And those are the ones I guess that parents tend to worry about. But for the very um highly intelligent, like Sheldon, if for those of you who have watched the young Sheldon on Netflix, that is a typical high functioning autistic child. And then but you also have other children who are non-verbal, who cannot talk, and those are the other extreme of autism. I guess most parents that worry are the ones that have children not like Sheldon, but those who have children that are completely non-verbal, and who may need to go to special needs school and things like that. Yeah, but it's a huge spectrum, and every child is different, but they all have difficulty with their social interaction and social emotional reciprocity and all that. So I hope that's helpful. Okay. I don't seem to have any more questions. So if you have your question asked, so we can continue with that. And I just want to, there are lots of things that people peddle online and say this and say that. Be very careful who you listen to when it comes to health issues. Don't just run with any information you hear. And that's why it's important for you to be able to verify information. But you're lucky because we're living in the days of artificial intelligence. So these days you can just ask your AI to tell you some information, and at least most of them to some extent be true. So you don't just take whatever people tell you by word of mouth. Feel free to go and research it and be sure, because misinformation can kill, just like ignorance. I don't know which one is worse between ignorance and misinformation. Somebody who doesn't know and doesn't know that they don't know is better than somebody who does not know and is given the wrong information. That is even more, I think, in my opinion, more dangerous. So that's that. Okay, we don't seem to have questions on Facebook. I hope people were not posting their questions on our Facebook group. So if you're on Facebook, don't post your question under the video in the group. You have to click on the video so that I'll be able to see your question. But if you drop your question directly under the video, then I won't be able to see it in my hand. Okay, I'm just checking, but I don't think there is anything like that. Okay. So we'll try and take we'll do another teaching on autism soon. Seems like it's a topic of interest. And while I'm on that, a lot of parents tell me they don't want to take vaccines, especially the MMR, and people have kind of demonized the MMR vaccine because they felt the MMR is a cause of autism. No, it is not. MMR does not cause autism. I know there was some publication, but that has been proven not to be true, and it has been taken off. And we are very confident now that we know that vaccine like MMR is not a cause of autism. So please let your children take the vaccines. Autism does not kill anybody, but measles can kill. Mumps can cause very severe disability. So please don't say. I do have a lot of parents who have one child already with autism and they are scared and they think maybe because they gave the child that particular first child vaccine, so that's why the child has autism. And then they decide that they won't give the next child the vaccines, and the child still has autism. So that tells you something. It is not the vaccine. So in such families, something genetic going on. So I've seen cases like that. So the two children in the family still have autism. One was vaccinated, one was not vaccinated. So at least if there's anything, it helps prove to the parent that the issue has nothing to do with vaccine. So it is all sorted. So that is just to, I know sometimes parents find it difficult to believe us, but that is the real truth. All right. Okay. So I got like another 15 to 18 minutes to go. We seem not to have many questions from Facebook today. I don't know. I hope people can see us on Facebook. Let me just check. Okay. So if you have any question, ask a question. I guess everybody is busy with the bustle of the started again. But not to worry. You can always watch our video again, and after watching, you can always ask your questions on our Facebook group if you still have any question. Okay, so I'm still waiting for your questions. So while I'm waiting for that, I'll just um, say a few things. This is a new year, and when it comes to making sure that we um, support the health of our children, there are some things we should all know. And I think I'll just focus a bit on the immunization things this today. So let's make sure that we take our children for the routine immunization. So always take our children for the routine immunization. Immunization is free. You can take immunization anywhere in the country. You don't have to. Some people, I do get questions from people who travel to the villages and they were like, "Oh, I have immunization. I'm going to miss it," and all that, blah blah blah. I always like people to know that you don't have to mix immunization because you travel. All you need to do is to go with your immunization card. You can walk into any of the health centers in any of the 777 local governments that we have in Nigeria, and you can get your immunization there. For those who live outside the country, you have your GP, your health visitor, or your pediatrician. For those in America and Canada, everybody has a pediatrician, and you can just get to them and they will make sure that your child is immunized. The good thing about immunization is that it kind of protects your baby already against the vaccine preventable diseases. So the child does not have to go through the illness. So the child is already protected. So which is why it's important for us to take our children. And for those of us in Nigeria, the good news is that we now have the malaria vaccine. Yes, malaria vaccine is now available and it's currently being rolled out. So when we say we are rolling out something, it means everybody is not going to get it at the same time. So we usually will start first with some states, and some states will get the malaria vaccine, and then um, after a while, gradually it will come to everybody. So just be patient, and it is not going to be for the adults for now. We are focusing on the children, especially the children under the age of 1, because they are the one that tends to um, die from malaria, severe malaria. Most of us, the adults, we already have our immune system very our immune system is quite good, so we're able to fight malaria by ourselves. So but for those who have for the babies, they are the one that are prone to having severe malaria. They are the one that tends to die from malaria. So we're going to start with them first, so they will get the malaria vaccine. So just watch out in your health centers when they have malaria vaccine. Just have to take your children under the age of 1 for the vaccine, and hopefully with time we can give more uh, category of people, and hopefully this will help us prevent people dying from malaria. So that's the good news to share, and we are grateful that we're like finally having it. Been in the pipeline for a number of years, but it's good that we now finally have the malaria vaccines. But the thing that discourage government is even the ones that we have already. Some of us are not taking them. So you can imagine we didn't take the ones that we already have, and now we also have new ones. So if we don't take the one we already have, how are we going to even take new one? So which is very discouraging, because like I always tell parents, it's not free. Vaccines are not free. Somebody is paying for it, even though we are getting it for free at the health centers. The government have to pay for it, so it is not completely free in court. So if the government pays so much thousands and millions of dollars to make sure we have these vaccines for free, the minimum we can do as parents, responsible parents, who are very concerned about the health of our children, is to take our children just for the vaccines. I mean, that's just our own rule. Obviously, the government is not going to come and take our children again and exclude them. So we have to make sure we take them. And I get a lot of questions about people saying, "Oh, we forgot our immunization dates and all that." There are some dates you should not forget. Your baby is 6 weeks, 10 weeks, 14 weeks. They will have immunization to take. 9 months they will have him, and I know the gap between the 14 weeks and the 9 months is quite a bit extensive, though there is some 6 months oral vitamin here anyway, but sometimes the gap has been much, so sometimes parents tend to forget. But this day we all use smartphones, so just put those reminders on your smartphone. Baby's immunization, put it there, just put it there from the one, or whenever you go for the immunization, they give you the next date. Just put it in your phone calendar and put an alarm on it, so that maybe a day or so before the date it can remind you to go for your immunization. So there's no excuse for us not to be forgetting immunization, because we can set up reminders for ourselves. So let's ensure that we take our children for this immunization on time, and that will help protect our children against those terrible killer diseases. Our goal is always to make sure that none of our children die from things that we can treat, things that we can prevent. And one of the ways we do that is by giving our children immunizations. Immunizations are safe. And just also remind us that sometimes when we know there's going to be an outbreak of a particular disease, we tend to give what we call supplementary immunization. And a lot of people do ask questions like, my child has already taken this immunization as a routine, it's already in the immunization card, they've taken it. And now people are coming around our houses, knocking on our gates or in the church, or the school has sent us a card or a letter to say they are going to give my child this vaccine. Should we take it again? So my child has taken it already. Should we take it again? And the answer is yes. Okay, too much vaccine does not cause any harm. It does not kill anybody. So it's actually safer than to actually be missing out. So the routine immunization is what you normally have to take your children for. The supplementary immunization is what we bring to you, the health professionals, our staff, and they come to you, volunteers, they come to you with those immunization, and it's usually for a specific period, for a specific time, maybe even for a specific group of children. And the reason why we do that is if we know there's going to be a measles outbreak, we want to make sure that we boost the immunity of all children in that area against measles. So even though your child has had a measles vaccine before at 9 months and at 15 months, but now your child is 2 years old and we know there's going to be a measles outbreak very soon, we still need to give all the children. So this will sometimes we go to the schools. So the school will send you a card to say they are coming to give you a measles vaccine. Or can your child take it? Please always say yes. Don't say, oh, my child has already taken 2 doses and blah blah blah. Just take it, okay? Number one, it doesn't cause any harm. Number two, it's going to boost your child's immunity. And then the more children that we are able to immunize at the same time, at that same period, it's kind of uh, cause the vaccine coverage to be so high that it can actually stop the epidemic. I'm trying to see how to explain that in a way. In other words, even though if we have so many children who are immunized, it's kind of make it difficult even for those who are not immunized to be affected, because the disease cannot easily spread because a lot of children are suddenly all immunized against that particular disease. So we do that a lot for measles. We do it again for polio, and thank God for we're almost getting to the point where we're actually kicking polio out for good completely. So we're almost there. We hope very soon polio will be like smallpox that has been completely eradicated. We're looking forward to getting there with polio very soon. But in the meantime, please let's make sure that we take the routine immunizations and the supplementary immunization. You are supposed to take the two together. There's no issues whatsoever with taking it. All right, so I hope that's helpful. Okay, I got one question on Facebook from Okoye Elizabeth Nkechi. It's quite a long one. So good evening, Doc. Happy New Year. Thanks for all you do. Thank you, Nkechi. My toddler, 23 months, 11 kilo, was stooling, watery stool, vomiting on Wednesday last week. So it took her to see the doctor. Okay, they did the test. Malaria was positive. She also has gastroenteritis. Injection was given to stop the vomiting. Injection was given for malaria. Then Coartem, amoxicillin, clavulanic acid, that's augmentin anyway, ibuprofen. But this weekend I noticed our stomach is a bit bloated. Okay, your question was so long and Facebook has cut off the right, so I can't see. You have to post a little bit more. You have to put again the parts after bloating, because I guess there's a minimum amount of character you can put in the comments for Facebook or for this kind of setting. But I think I remember I've seen your posts on our Facebook group, if I remember correctly. And just to say that when children have gastroenteritis, one of the complications that can happen is that they can have what we call electrolyte imbalance. And one of the electrolytes that can be low is potassium, which is why it's important that it's not just to be giving the child injections to stop vomiting and all that. Another very important thing is what we call replacement therapy. That is ORS. The ORS is so important to give the child because when children are having diarrhea, they are not only losing water, they are losing what we call electrolytes. They are losing their sodium, they are losing their potassium, they are losing bicarbonates. So these are very important uh, electrolytes. I'm looking for the right word, a word that is simpler. Something like important agents in the body. And when they are low, in the body, then there are consequences because the body needs them. So, for example, when the potassium is low, it can cause what we call paralytic ileus. So, like the intestine will not be able to function properly, and that may also explain why the tummy is bloated. So, what we need, so for your child, I don't know whether your doctor did the electrolyte test. If your child is having diarrhea, vomiting, apart from the full blood counts, malaria, they need to do what we call the electrolytes profile just to check the sodium, check the potassium, check the bicarbonate, check that they are normal. If they are not normal because the child has lost a lot of them in the stool, then what the doctor needs to do is to replace them. But even without doing tests, if you are giving your child ORS, which is why we always tell parents give ORS, give ORS. The ORS has potassium, the ORS has sodium, has bicarbonate. The ORS, the one you buy in the shops. The soft sugar solution has just the sugar, the sodium, and the chloride. It doesn't have potassium. So, but if you give the one that is sold in the sachet, the ORS sachet that you mix by yourself, it has potassium, it has bicarbonate. So if you give it to the child, the electrolyte will correct. So when children are stooling and vomiting, the most important thing is not to stop the stooling. We don't actually aim to stop the stooling because the stooling will stop by itself. But what we really aim for is to replace what the child is losing as at the time the child is having that diarrhea. So the child is passing out a lot of potassium, passing out a lot of water. What we want to do is to replace it. And sometimes just giving ORS for a child who can drink will take care of it. But if your child is vomiting, I think your own case, your child is vomiting, then if the child is not able to keep the ORS down by mouth, then we have to give it as what we call intravenous fluids. We give it as, those drip. We'll give the child the drip and give the one that has potassium, the one that can correct potassium. So, if you're already home, you may want to go back to your doctors so that they can check and they can actually do the blood test. And if it is low, which is if I say a child who has had diarrhea now coming down with a bloated tummy, the first thing I would think about is potassium deficiency. And just giving ORS or doing the blood test, and if it is low, we will have to give the potassium in a drip to the child if the child cannot drink ORS, and then hopefully we'll recheck it again maybe after 24 48 hours to see whether we have been able to make some corrections to the electrolytes derangements. That's what we normally call it. So I don't know whether that's helpful, Koya. I hope you're still there because your question was cut in half and then I didn't see your updates, and but I hope you listen to the answer because I think I must have seen this question before and I think we must have answered it. But another thing that struck me in your question, which I want to address in the last 1 minute before our time is up, is let's try and stay away from intramuscular injection in 2025. I do get a lot of questions about mothers who have taking their children to the hospital because the child has malaria, and then they gave the child injection into the buttocks or whatever, and the next thing the children cannot walk or they are limping, and that is because the nerve, what we call the sciatic nerve that supplies the leg, that tends to make us walk, it runs through that buttock area. It's actually runs through that area. So if people, when giving injection, they don't give it in what we call the upper quadrant, far away from where they are likely to catch the nerves, especially if you go to all this hospital with auxiliary nurses or untrained nurses, because then they're just going to give the injection anyway. They are not trained to know that there are certain areas you need to avoid. In fact, as far as pediatricians are concerned, I don't want you to even be given injection at all. I don't want the children to have injections at all. If they can take it by mouth, it's better. If they cannot take it by mouth, we give it through the drip. The only time we want to give injections is if we have no alternatives, then we have to give injection. But if we have alternatives, and the best is through the mouth. I know a lot of mothers, I don't know where we get that idea from, like, injection work faster, injection is better. It is not. Injection is not better. It doesn't work faster. Injection is actually more dangerous. It's tends to give more complications. And I do see a lot of these posts on our Facebook group. My child deck injection cannot work again. What do I do? What do I do? So please do not take injection if your child is able to eat, if your child is able to drink, if your child can take the drugs by mouth. Do not take injections. It's only time your child should take injections if the child cannot drink, the child is vomiting the drugs, then we have no alternative. So that is the most important information. Okay, Nkechi, you say your child refused the ORS. So if a child refuses the ORS, you cannot just give only water. Only water is not going to do the work. It's actually more dangerous if a child is stooling and vomiting and you are only giving back water, because the child has not lost only water. The child has lost sodium, has lost potassium, has lost lots of electrolytes. So when you actually give back only water, you actually dilute the what we call the osmolality and all those. I don't want to use big grammar, but you're actually making those electrolytes more diluted, the few remaining. So which is even not good. Your baby can actually have what we call water intoxication and all that. So, and that's not good for the brain. So a child who has lost a lot of electrolytes, if the child cannot drink ORS, that child has to be put on a drip. That is the answer. The child has to be put on intravenous fluid replacement, because we need to replace what the child has lost. The child has lost water, the child has lost electrolytes and all that. We need to replace those things. And if the way we normally do it for most children is to just give them ORS. Let them keep drinking the ORS. As they keep drinking the ORS, it will correct, it will normalize, as the body will take care of the excess water and all that. But if they cannot drink ORS, they have to be admitted. Any child who is vomiting, having diarrhea, and is sick enough not to be able to drink, if the child cannot drink, that child has to stay in the hospital. That child is not going home. That child has to be in the hospital, and that child has to be rehydrated. What kills children in diarrhea? People always wonder, diarrhea, I mean, it's so common, it's so straightforward. Why should diarrhea kill a child? It is not the stooling that kills the child. It is the dehydration, it is the electrolyte imbalance. So those are the two things. So those are the things we focus on. It is not giving the drugs to stop the stooling or to stop the vomiting. Those are secondary. The most important thing is to rehydrate that child and replace all the electrolytes. Those are the two priority for the doctors. So we do that, like I said, just give ORS. It will rehydrate the child, replace the water. It will also replace the electrolytes. But if you are lucky to have a child who is not able to drink, that child has to be in the hospital. That child has to be on intravenous fluid and electrolyte replacement. So I recommend you take the child back to the hospital. If the tummy is still bloated, let them do the electrolyte test and let them correct whatever deficiency may be there. All right, our time is up. Thank you so much for joining me today. I appreciate those of you who were able to join, those of you who have questions. Oh, did I miss today's question? Okay, somebody asked a question. If they see speeds, you're having pain in your waist and all that, oh, you have to see your doctors. Okay, it's not an health center issue. You have to see a proper doctors. You have to see a physician, preferably a neurologist. So there are some cases that are not health center cases. Okay, health centers, all they do is to give you people drip and give you malaria drugs. It is not appropriate treatment. So if you're having waist pain and it is causing you to be having symptoms on your in your brain, in your toes, you are having what we call neurological symptoms. We need to know whether something in your spinal cord is shaking or pressing on something. It's an emergency, it's something urgent. You really need to go to the hospital so that they can check you out, and it is not an health center you're going. And this year, let's avoid all these hospitals that the only thing they always tell you is malaria, is typhoid. There are many things that can affect us beyond malaria and typhoid, please. So don't fall for that in 2025. You go to hospitals that have the right specialists. Go to hospitals that have physicians for adult, pediatrician for children, and they can refer you to the right specialist. So unfortunately, it's really so sad that we got to this stage in our health system in Nigeria, where when we go to health centers, ideally the health center should know that, oh, if somebody comes to me and this is something that is not in my standard order, these are not the things we're supposed to be treating, they should just have told you go to general hospital or go to teaching hospital. They are not supposed to start treating for malaria. What is malaria got to do with waist pain? And somebody is having waist pain, is having something that look like shock symptoms to the brain, it's having what look like your toes. There's nothing malaria in those symptoms. This is a symptom of something affecting your nerves, affecting your neurological system. So that is an hospital, a specialist case. It's not just giving you malaria for what? So you're not having fever, you're not vomiting, you're not saying you're not able to eat. So please avoid those kind of situations. You yourself take yourself to a proper hospital. Health center is for you to just go for your immunization, weight check, and all those basic things. And if it's a comprehensive health center where they have doctors, then you can see them for common issues, malaria, cough, cancer, all those kind of things. But anything that is more than that, please take yourself to a proper hospital that has proper doctors and specialists so that they can take care of you properly. Hopefully one day we'll get our health system fixed and we'll be able to do the right thing, but we are working on that. All right, thank you so much everyone for joining me today. If you still have any questions, please go to our Facebook group. We have we actually have 4 Facebook groups, but go to the Ask the Pediatricians for Children Health Issues and ATP Family for the adult health issues. Please post your question in the right groups so that we can assist you on time. On Thursday, we'll come again with another teaching. I think I'll be doing that teaching. Just watch out for our flyers for what we're going to be talking about. And if you have any particular topic you would like us to talk about, feel free to post it on our Facebook group or send us as a message, and we can try and address it in subsequent teachings on Thursdays and Mondays for question and answer. Thank you so much for being with me today. Have a wonderful evening, and it is bye from me. Bye-bye.